So I gotta look. I want to make sure you're all in the camera. Marcus is not in the camera. If you don't see yourself in the camera, you gotta scoot in.
There's a couple more sliding in.
Okay, let's see. Pretty good crew actually. All right, so I would love to introduce to you Dr. She's pretty darn close to doctor. She is a doctor, but she'll
I
have
am one.
one doctor. She'll be double doctor pretty soon. I know. Hey. Dr. Allison Naber, who is an occupational therapist and also a professor at University of South Dakota. She's an SMSU alumni, so let's give her an SMSU welcome, huh?
Thank you very much. So I was excited to be able to join the class again this year. It's been a few years. And that year we were brave and drove all the way up to Marshall one evening. So this is a little easier. There's no commute, but I'm sorry I can't be in the room there with you. So I went to SMSU when it was still SSU. So some time ago, it was Southwest State when I was there. And I got my degree in psychology. At the time, I was a biology major and then switched to psychology. And then in my junior year, I was accepted into OT school. So I didn't finish the bio major. I decided I had all my prereqs and I was happy and content and wrapped up my psychology degree. But I loved my time at SMSU. It was wonderful and great program. And there's so much more even on campus now that I'm to the point in my journey where I'm starting to plan college with my oldest child. There's way more on campus than when I was in school there. But after I was at SSU, I got into grad school at the University of South Dakota in our OT program. At that time, it was a master's program. And so I graduated from that in 2004. And then I worked for a little bit of time in long-term care before I started working in Marshall at Big Stone Therapies in the mall, doing some outpatient hands. While I was there, I got certified in occupational health, so functional capacity evals, job screens, job analysis. I was lymphedema certified as well. We did some home health, assisted living, but most of my caseload was in upper extremity rehab, primarily elbow to hand when I was there. While in the clinic, I went back to school to get my post-professional doctorate, so my OTD, and I got that at the University of South Dakota as well. For that doctorate, my project was focused on breast cancer related lymphedema and creating a wellness, a holistic wellness program for women who had breast cancer, had lymphedema, and were beyond that traditional rehab, but trying to get back to their life roles and activities, which can be pretty challenging for some after going through that experience. After I graduated with my OTD, a job opening, a faculty position opened up here at the University of South Dakota. And the chair at the time was also the chair when I was way back in the OT program, asked me to apply for that. And long story short, here I am almost, well, 5 years later, going on 6 here in the OT program. So I'm excited to share about occupational therapy in general with you, and then about our program specifically. I'm going to try to keep my eye on the time as well, so you guys can play some wheelchair basketball. I also want to tell you why I'm dressed so casually today. One of the fun things our students do is they do different theme days to raise money for some of their travel to our national conference and that sort of thing. So today was Coyote Leisure Day, and so I'm wearing jeans and a Coyote basketball t-shirt, but normally this is not how I dress for work, but it was for a good cause and I decided to stick with it for the evening. So all right, let's tell you a little bit about occupational therapy in general. So occupational therapy is really just looking at participation in your everyday occupations. So I have a few definitions on here. Honestly, I describe occupational therapy a little bit differently depending on who I'm talking to, what their concerns might be, that sort of thing. But really, occupational therapy looks at anything that occupies or fills our times. So it's the things that we want, need, or have to do. It's not just a job, although working in occupational health for so many years, that is a big area of what I did in practice. It really is all those daily activities. And one of the big philosophies and the roots of quite a bit of my research is engaging in occupation and it literally keeps us healthy. It impacts our quality of life, our health and well-being. And so much of my research looks at the aging process and that engagement and that perceptions of well-being. So this screen just shows a few things that I anticipate, if you look at all of the little circles on the outside, are some of the things you've done to occupy your time today. So you got up, you are all dressed and in class. So you've done those. Some of you might have cooked. Some of you have maybe been to work today. Maybe you've taken care of a pet or done some leisure or exercise. But OT really looks at all those aspects that make up a person's daily routine and the occupations that they participate in throughout the day. Oh, sorry, too many clicks. Okay, so in OT, we talk about domain and process. That's how we really describe our profession through our practice framework. The domain are all the different areas that occupational therapy addresses. So we look at occupations, like I said, those things you want, need, or have to do, and just everyday activities. We look at different contexts. So by that, I mean your social context, your environmental, all those different places where your occupations and circumstances where your occupations take place. We look at people's skills and their routines, and also client factors, like what is their strength, what is their motion, their cognition, their mental health status, their coordination, those sorts of things. And then on the right-hand side of the screen is the process of OT. So we begin our care for our clients by looking at evaluation and assessment. So where are they at? Identifying their goals and priorities, their concerns, and coming up with our plan of how to address that. Then we provide interventions to work towards their goals and really look at outcomes. How are they performing or functioning or participating following our therapy? One thing I'd like to mention is some of these pictures that you're seeing, I picked them not just because I'm in this top one doing one of my favorite things, which is splinting, but because it's showing you different parts of our departments in our different classrooms. So this is an ADL suite that we have on the bottom left, and then on the top right is I'm with a student working on an orthosis in the classroom where we do splinting. Some of the practice settings that you would encounter in OTN are listed here. I'm not going to read them all to you, but essentially we work pretty much everywhere. Academia and research, which is what I do now. We work in people's homes. We do community-based settings. I have a student in January who will be doing part of her capstone in a homeless shelter. So we do different community-based settings. Hospitals is traditional, long-term care, skilled nursing facilities. Hand therapy is one of my passion areas. You'll see us in schools and lots of different emerging practice areas as well. In OT, there's several different certifications you get. I selected those that are through our American Occupational Therapy Association for this presentation. But like myself, you could get lymphedema certified. You can get certified in occupational health and ergonomics. But through our professional association, there's gerontology, pediatrics, mental health, and physical rehab. And then you can also get different specialty certifications. Like there's OTs who focus on returning to driving and adapting driving or vehicles. Environmental modification is another one. I had a student do a capstone recently where she worked with city planning and parks and rec and really helped to design some accessible environments. You can be an expert in feeding, low vision, and even in the schools are just a few. So sometimes students want to know what a typical day look like, because eventually you have to get a job once you're all done with school. So I have just a few examples of some different typical schedules. A lot of OT tends to fall within the work week, what you would think Monday through Friday. However, in a lot of hospital or skilled nursing facilities, you do need to do rotating weekend shifts or holidays. Outpatient clinics are typically open Monday through Friday. Some do longer days. So there's lots of OTs who might work 410s. I'm coming across a few OTs who work 312s. That's not as common, but typically outpatient clinics are not open on the weekend. One nice perk about being a school system OT is you typically are just working during the school year, although some do see birth to 3 caseloads in the summer, but it's not every day, all day, like a typical school year would be. Some of the things that we do during our day are assessment and intervention sessions. These usually are between 30 to 60 minutes that you spend with each patient. In some hand therapy clinics, a new patient is walking in every 15 to 30 minutes, and you might be staggered, depending on how that clinic is set up. And if they do kind of team-based care where a rehab aide is involved and that sort of thing. It's the range of a full day of clients. We're actually just wrapping up some of our field works. And my students range from 5 to 6 clients a day, up to 20 in acute care. So it really depends on what setting you're in. In a mental health setting, I had a student who saw 32 people in a day, but they were in groups. And so she did not have 32 individual sessions, but she did see 32 different people she documented on. We do documentation, there's interprofessional meetings, we have to do education. And then in rural areas, like in Marshall, there is travel between facilities. Sometimes that travel's a nice break, and it gives you a little bit of time to dictate a note or just think about your upcoming sessions. But in rural areas, there certainly is a component of travel. There's always pros and cons for every profession, and so I wanted to share some of those. Some of the pros that I really think, there's some listed here on the screen. Some of the pros that I really felt were things I loved about, and I do love about being an OT, is that involvement in the lives of those we work with. You get to know people on such a deep level and form really impactful relationships because you're working on getting them back to things that they need or want to do. And you learn about their lives and what's brought them to where they are now and what their goals are. Oftentimes therapy, whether it's PT or OT or speech, we're bringing them a lot of hope. And we always talk about what we can do and what our goals are, instead of focusing on sometimes what can be some negative or really scary diagnoses. We're always looking at that future. Where do we want to be, and driving people forward, which I think is really rewarding. You're really active as an OT. You don't sit behind a desk. You are out and doing things, which is always nice. Some cons, there can be some heavy caseloads depending on where you work. Anything in healthcare is productivity driven, unfortunately, but that's something that you learn to work with. Sometimes we're impacted by third-party reimbursement. So sometimes there's things that we want or wish we could do, but insurance just won't cover it. That can be hard. Being an OT can be physically demanding depending on what practice setting you're in. And sometimes we have situations where there's slow progress, and that can be hard at times too. But overall, I would say the pros definitely outweigh the cons. When we think about healthcare in general, and even in the school system, OT is one part of an interprofessional team. At USD, we focus a lot on interprofessional education and collaboration because you really can't do it all alone. You typically have partners, and there's a whole team, including the patients themselves, that are working with that. And as an OT, you're really a critical component. As a student, I always wanted to know, what could I make in that job? How many of you, show me your hands, are worried about having to pay off student loans someday? So if you've thought about it, you might want to know what money you'll make in your career. I know that was something I wondered. So these are taken from just some national, it's not salary.com, but national survey, the Bureau of Labor Statistics data. And so the hourly or the salary bases do vary depending on what part of the country you're in. Cost of living is very different as well. But these are just some examples of some salary parameters for occupational therapists. Okay, so a little bit about USD OT for you today. So here's our building. Have any of you been to the Dome before? Did you grow up in South Dakota or come here for band competitions? I saw one hand fly. Yep, a lot of people have been in our Dome. So that's on the far right of the picture. The building in the middle, the two-story building, is our basketball arena. That is where I will spend a lot of my time this winter. I love going to basketball games here on campus. That one-story building is our building. And so actually if you look at the one-story building, the second window from the right is the office I'm sitting in right now. But we share that whole building. The far end in the picture is the weight room for all the athletes on campus. There's kinesiology and sports medicine next. And then physical therapy and occupational therapy have a huge part of that one-story building for our classrooms and our labs and that sort of thing. We really do have a state-of-the-art learning environment. Our department is relatively new, and we keep adding more and more technology into our classrooms. We have nationally and internationally recognized faculty. Moses, who has the office next to me, has been the United States OT representative on the World Federation of OT for a decade. He actually just retired from that role. But we have an OT doing trauma-informed care who's known nationally and internationally as well. So really recognized faculty with lots of variety of interest areas. We also have a low faculty to student ratio. We enrolled 32 students per cohort, and we have 9 faculty. So we get to know our students very well and get to have that nice classroom size. That's one of the reasons I picked USDOT, is I was used to classroom sizes there in Marshall. So a little bit about our program. We're a 3-year program. There's 114 credits, and you graduate with a doctorate of occupational therapy. We are accredited by ACOT, which is important. There's some new and emerging programs, but without ACOT accreditation, you can't sit for the national board exam, which means you can't get licensed. So it is important to go to an ACOT approved school. We have a 100% pass rate on our national board exam, the exam you have to take for licensure. So we're really proud of that. Our students are well prepared and perform well on that exam year after year. In the program, you do 3 weeks of level 1. So you go out to 3 different settings and spend a week with a therapist. I coordinate the level 2s, which are 2 12-week experiences in your 3rd year. And then you wrap up with a 14-week capstone experience. And that's really a student-directed project that can focus on clinical practice, research, policy, leadership. A lot of our students pick clinical practice. So here's our OT faculty. I won't go through all of the details about all of us, but we have the top left is our chair, Dr. Renelle Nissen. Her expertise is in gerontology and specifically with Alzheimer's and dementia and telehealth. She was doing a lot with telehealth before COVID, even before therapists were using telehealth. So that's been kind of interesting to see that transition with more practitioners doing that. The next faculty is Dr. Shauna Cerny. She's her expertise is in pediatrics and that trauma-informed care. The third one is our newest faculty member. She's a recent grad of our program, Katie. Mackenzie's on the top right. She really looks at the scholarship of teaching and learning, teaches a lot of our first year courses. Dr. Karen Hebert is on the bottom left. She looks at, in her research, cognition and emotions and works with individuals with Parkinson's disease. Moses is the next faculty. He does theory. He's developed several theories in occupational therapy, and then he also does mental health. Dr. Whitney Lucas Molitor is in the center. She's board certified in gerontology. Her and I actually work together a lot on our research for interprofessional education and then aging. Next is Dr. McHugh. She is specialized in pediatrics, and then of course there's me. So we have 2 OT staff. The reason I show you their pictures is Rita on the right. If you ever apply to our program, you will connect with Rita for several months in the process of application until you arrive on campus. And Marcia just takes care of all of us and makes sure everything is in working order in our department. So they are critical. Just like in the clinic, your staff are critical, they are on campus as well. So really, when I tell people about USDOT, I like this picture is one of our core symbols of our program. And you can see the 1, 2, 3 in the center of the picture. That kind of is the 3 years of the program. So in the first year, you really learn about the foundational information, build up your foundational knowledge for theory, science courses, mental health. In the second year of the program is all your practice-based courses. That's when you're going out into the clinics for those 1 weeks. And then in the third year of the program is where it's all in the clinic. So you're doing your fieldworks and then your capstone experience. But the petals around the outside are really those core constructs that we emphasize in our program, including focusing on individualized care. So you guys have probably heard terms like patient-centered care, looking at evidence-based practice, theory-driven practice, of course, addressing the needs of all members of our society and ensuring occupational justice as well. A unique thing about USDOT is we do have 4 specializations. So on top of graduating with a Doctor of Occupational Therapy, you can also graduate on your diploma and be able to tell the world that you have a specialization. So we have these 4 tracks: pediatric, rural underserved, mental health, and neuroscience and rehab. And so students who pursue these specializations obviously have a passion for working in that area of practice one day. They do a level 2 fieldwork, their capstone project, and a research project in their area of specialization. And then they also take an elective course. This is really unique. I'm not sure of another OT program who has specializations, but it's something that we're really excited and proud of in our department. Okay, this next slide doesn't like to load very quickly. Oh, and then I went right past it. Give me 1 second. Here we go. So this slide is what, it says why USDOT. So I want to share a little bit with you when I was a student, why I picked USD and those things that I think still hold true today. So when I was looking at OT schools, like any good student, I applied to several schools because that's what you should do. Some of the reasons I was drawn to USD was some of the same reasons why I picked to go to SSU or SMSU in Marshall. And that was the small class sizes. I met all the faculty when I came to see the department. I could see by interacting with some of the students, that relationship that they had with the faculty, access to faculty, being in a small cohort. My OT friends that I had in the program are still some of the best friends that I have now, because you go through several years of work together. You get to be important people and important support systems for one another. The other reasons why I think USDOT is really fabulous is some of the things you see in the pictures. So you can see some of the technology that we have and some of the different opportunities. So starting kind of on the left and working the way to the right when you're looking at the screen, the top picture on the left is our OT students doing a research project with the student athletes. And they were really looking at visual perception and how addressing visual perception improved their performance in their sport. The bottom picture shows our pediatric clinic. And one of the things that we do each semester fall, we focus on adults, and then in the spring, we focus on peds. We have volunteers from our community come in, and our students get to provide therapy sessions here on campus for different individuals with a variety of concerns, working alongside faculty and under that mentorship before they even ever go out into their fieldwork experiences. The second row shows our ADL suite again. The bottom picture is our simulation center. So we are part of the School of Health Sciences that is also connected with the medical school. And so we have simulation rooms. And so this room is actually a hospital room. Right there, this class, they were learning how to do vital signs, taking respiratory rates and blood pressure. So it's using a mannequin, but we also use live standardized patients as well to do some of our practical exams. You can see our classroom in the third column at the top, our peds clinic again in that middle picture. The bottom picture is part of the assistive technology class. So this is an individual whose husband has an accessible van. So the students got to go out and use all of the different technology they have in their home. The top far right column is a pool that we have here in the athletics department. And it is a HydroWorks pool. The whole floor of that pool comes up level with the floor of the area so that you can roll someone into the pool or have them walk straight across into there. You can put up parallel bars and different sorts of things, but we use that during our clinic sessions if a person is appropriate for aquatic therapy. The middle picture was a safe driving car fit event that our student OT group did. And then in the bottom picture is our 3D printer, which is really cool. Students get to use that and make different adaptive tools on the 3D printer in a summer course. So I have already talked a little bit about the pass rate on our national board exam. When you look at OT programs as well, affordability is a huge thing for students. And so USD does have different reciprocity payment structures. And then there's also a WICHE program where if you're a resident of certain states, you can qualify for in-state tuition in South Dakota. So our admissions can always help identify if you meet those criteria. We have high employment placement rates. I was just reading some wrap-up stuff from our fieldwork students who just finished, and several of them already have an opportunity for a position at one of the places they did their fieldwork. Our students go on fieldwork, those 12-week rotations all across the United States. So I have 2 students in California, 1 in Oregon, 1 in Arizona. So they get to go warm places when we're super cold here. But we also have them all across the Midwest and out to the East as well. In active learning, how many of you, you've been listening to me talk for several minutes, how many of you would prefer to actually do something in the classroom than listen to lecture? Show me your hands. Yeah, that's how I learn as well. And as OTs, many of us are doers. And so pretty much every class session has an active component. There's some courses that align with needing some lecture, but our faculty are really, we utilize a lot of active learning things in our classroom as well to break up some of that lecture component. These are just some of the different opportunities our students get to participate in. So that teaching and research lab is that space that I talked about where our community members come in. PTE is our National Honor Society. We do a lot of half-day or one-day experiences in clinics throughout the various courses in our program. SOTA is our student organization. They're very active in community service. One of the highlights for students is we do a PT-OT pediatric evaluation day where parents can bring their children in and the OT and PT students work together collaboratively to perform a standardized assessment, write up a report and some treatment recommendations for those families. We have a huge IPE day on our campus where we have, I think the last one had like 400 and some students from USD, from Brookings, from our Sioux Falls campus that participated in an interprofessional case day. Our school goes to the state capitol, so that's kind of fun. And then our students attend our national conference each year. So it's not required, but many of them choose to participate in that. I want to show you just a quick video that we show at admissions, and it's one of our past students talking. This is actually a video that we took in the classroom. You won't get to see too much of me, but that is just in my class where I teach range of motion testing.
I'm Rebecca Almeida, and I graduated in 2017, and I was in the occupational therapy program here at USD.
I'm gonna pause it 1 second. Can you guys all hear the sound? Okay, good.
I thought it was awesome. I loved the professors. They were all really great and would answer any questions. Their open door policy was awesome. I loved that I had a smaller class. I would say our skills checks were very helpful, as nerve-wracking as they were, because you actually got to use a simulator and feel like you were actually in like a nursing home or in the hospital. The tight-knit class was really helpful too, just because I still ask my classmates a lot of questions. The professors are very open even when we are out of school too, so if we have questions, we can ask them as well. I might have had some questions when I was on my fieldworks, but for the most part, especially now, I am the sole OT at the practice I'm at. I think it prepared me very well for it.
So I like that video because you get to see more of our department, but also Becky's done some really great things. She actually is an entrepreneur. So she has a company out in the Black Hills where it is adaptive play out in the environment. And so just a really cool program that she runs there where children get to come and do different adaptive play, but she uses the natural environment of the Black Hills as the setting for her therapy that she provides, which is pretty cool. So some general education requirements. To be an occupational therapist, you have to have a minimum of a master's degree. Like I said, USD provides a doctoral degree. Regardless of your degree level, you have 6 months of field work. So that's 2 12-week experiences in your 3rd year of the program. Then you have to pass a national board exam and then get licensed by your state. There's any state exam. Some states have requirements where you have to take like a bloodborne pathogens class or implicit bias training, that sort of thing, before you can get a license. And then you do need a license to practice, which is pretty typical for the board exam and licensure of other healthcare professions. Here's just a little bit about USD, and I kind of wanted to touch on a few things here. Some suggestions that I give students that come to campus visits and that sort of thing. And for any of you thinking of going into occupational therapy school, regardless of where that might be, are really to just be involved on campus there at SMSU. Be involved in different student activities, take on some leadership roles in some student organizations if you can. Observe as many OT settings as possible. So OT is such a diverse profession. It's one of the things I loved about it, because any day of the week I could be doing something different. But if you only see one area of occupational therapy, you might not be quite sure what you would want to do. And so I love it when I look at an admissions application and they've observed in 3 or 4 or 5 different practice settings, because they've truly seen all the different areas that OT can be involved in. We definitely look for students who've been involved in community service activities or doing something with the summer program, helping at their church or different activities there. Mission trips are great to see, but just really getting some exposure to some diverse people and experiences and observations in lots of different settings as well. I'm happy to share these slides too, so that you can click on any of the links for our departments or the application process as well. Here's just a few more tips about standing out. Obviously, excelling in your undergraduate coursework. For OT school, your prerequisite GPAs are going to be important. Many programs, including ours, do not have a baseline GRE that you have to have, but that makes some of that graduate or undergraduate GPA so much more important. Getting experience, so working in an area or observing an OT would be wonderful. Working on different professional behaviors, some of those soft skills of collaborating with others, being able to communicate well with other people are essential as well. And then just getting some experience in leadership, like I said. So here's just a few more links. And like I said, I'll share these slides so that you have that information. But I really was hoping to spend the rest of our time just answering some of your questions. So I'm going to stop sharing my screen so then I can see you a little bit larger on my laptop here. So what kind of questions do you guys have for me about occupational therapy? And I don't know your names, so you can just shout them out.
What's your favorite part about your job specifically?
My job here at USD. I think that the thing that really drew me to teaching as well is being able to connect with students. My favorite thing about my job, that's hard because I like so many parts of my job, but probably the thing that is most rewarding is I am the academic fieldwork coordinator. So I start with students in their first year, and I get to work with them all the way through the end of their fieldwork experiences with where do they want to go and picking their sites. But then I also get to go out and see them on their fieldworks as well. So I get to see those first days in the program and then to now where they're just wrapping up right now in the semester and they're ready to be OTs. And so being a big part of that journey and forming relationships. So all of our faculty have advisees, but I advise all 32 students because I help them with that fieldwork journey. So that's probably my favorite part about what I get to do. I think there is a question from Audrey in the chat. So do you require the GRE? We actually took their GRE requirement off. That was after quite a bit of research, trying to see if it was a good predictor of anything. And like a lot of other programs have realized, there's many other factors that determine if our students will be successful in the program. So you do not have to have that GRE.
You're gonna have OT students that are gonna love that.
Yeah, the GRE was a doozy. So what other questions do you guys have?
I'm going to ask you a big one, Allison, that a lot of my students ask. And they talked to Wade Vandover about a month ago. So Allison, Marshall, so our boss was Wade.
Yep.
So they asked, and the big question is OTD versus master's degree.
Yeah. You know, there's a couple different ways that you can look at that. Some of it just depends really on what you think you might want to do as a professional. The benefit of an OTD is that you do have additional coursework that prepares you, I think, to be an entrepreneur a little bit better. You get classes in running a business and developing a business plan and leadership. Classes that prepare you if you want to teach one day as well. The other benefit is that capstone experience, being able to do your own student selective and student driven project. The master's degree is entry level into the profession, and there's some students who that actually is a really good fit for them. They don't have that desire to do that last step of that capstone. So that's something to think about as well. The biggest way I tell people to decide what they want to do is think about that. What are your end goals? Do you ever want to have your own practice or be in a leadership position or a role? That would be an important thing to think about. The other thing to think about too is there's several OTD programs that are similar in credit count to a master's degree program. Some master's degrees have so many credits that you could almost be just paying for an OTD. So that would be something that I would highly recommend looking at. What credit load are you paying for and what degree are you getting out of it? Because some of the master's degrees are pretty close to the credit load of some doctoral programs, or just taking another extra semester and having your doctorate degree. So as far as a like salary standpoint and that sort of thing, there are certainly some companies that are looking for that OTD, but there's others that hire that master's degree too. So I can't tell you that that there's a disadvantage to having a master's degree. It really looks at that long-term professional goals and where do you see yourself wanting to function one day. I think OTD students, like I said, you get that experience in business, leadership, research. You have a higher emphasis on research as well. Audrey's asking, do you know when OT is switching from the master's to the doctorate? That was a huge professional issue. And so right now they have said they're not going to change, like our standards already passed in 2018. They won't go up to be looked at again until next year. The new draft comes out. There could be a change at that point that requires an OTD as entry level instead of the master's, but that'll be the soonest that could go up for a changes starting in 2023 when we revise our standards again. So for now, both are considered entry level.
So then if you did change your standards in 2023, there probably would be a few year grace period, I would imagine.
Yeah, they're gonna let schools finish out their cohorts. There's more and more schools that are doing the transition to the doctorate level anyway, even though that isn't a requirement. But yes, they wouldn't cut someone off midway through their master's degree, but they would halt enrollment for entry-level master's programs.
Sure.
But yeah, there would be a grace period. Mm-hmm.
That was a great answer because I do get that all the time. Yeah.
Yeah, they are going to just not, it's the same thing happened when I was graduating with my master's degree. We were graduating with a master's degree, but at the time the baseline requirement was a bachelor's degree. And so everyone supervising me on my field works, they all have bachelor's degrees. Whereas I was coming out with a master's, and similar things happened in PT when they switched to the DPT as well. But there is that grace period. They would never cut students off partway through their curriculum.
Yeah, thank you.
Mm-hmm.
Guys, what other questions do you have? We have 4 minutes. When we get there, we get there. So Allison has a wealth of knowledge, as you can see. So her and I practiced together, but it hasn't been that long ago, but it's been a while ago because we were really young. We were so young, weren't we? Yeah.
It's been a while since I lived in Marshall. I get that reminder when I see pictures of children in places, but yeah. Yeah, in the clinic, like I said, I did a lot of hand therapy and a lot of occupational health. So we went out to the industries in the community and helped them with employee safety and keeping their workers safe and preventing injuries. From an orthopedic standpoint, post-surgery fractures. I loved that part of being an OT. I love anatomy. Even now, my students are like, how many times can you talk about a joint structure? I think it's really exciting, especially when you can figure out how to fix that joint and to get things moving again. So there's definitely OT that's very anatomy and science driven, but there's also OT that's very mental health focused. And so it is a great opportunity because you can kind of find your niche, so to speak.
What other questions do you guys have? Anything? So I brought all the toys. Could you, maybe I'm going to bring these out. We usually do some simulation. I don't want to talk too much surprise, but talk about some of this. So the built up silverware. I got my total hip kit. Remember those?
Yeah.
Okay. Talk a little bit about what you do with patients with that kind of thing.
Yeah. And so with different conditions, there's a few different, in my summer class that I teach, I really focus on different trajectories basically in your OT. So we either have a situation that we can resolve and we can rehab and they go back to just how they were before. And so that you're really focusing on getting rid of those concerns, that fracture healing, the range of motion and strength going back to normal. But occasionally there's a period of time with some conditions where they're not allowed to do things. So how many of you have had a parent or a grandparent who's had a knee replacement or a hip replacement or back surgery? Yeah, so there's different rules. So like with back surgery, you can't bend or twist or pull or push with too much force. And so we might use some of those adaptive equipments in that bag to help someone with their dressing. So getting their socks and their pants and those things on. And so the reacher grabber, actually, I just ordered my mother-in-law one because she fell at the farm because she was trying to reach something and no one was home to help her. And the poor thing, I was like, how does my mother-in-law not have a reacher when I'm an OT? So she does now. There's a thing that you can use to pull your socks on. Those are really common with lower extremity or back injuries. And so what we're trying to do with some of those, either short-term or long-term, we're trying to help someone adapt to be able to do what they need or have to do. And so sometimes we use equipment for that purpose. Some of the large handled utensils we use for things like people who have arthritis or Parkinson's if they're weighted. I can't tell if they're weighted or not. But if they're weighted, we can use those for Parkinson's because that weight will help decrease the volume of that tremor and help them to be able to do some fine motor things like feeding. We sometimes will use those too with like a child who has cerebral palsy and has challenges with their grip. We might use the adaptive or wide-handled utensils as well. So sometimes we're using one of these off-the-shelf items. Sometimes, like I showed you, we have our 3D printer and we're printing something because a tool that exists isn't quite what we want. Or it's cheaper to actually 3D print something for an individual. And other times we're doing big adaptations. So OTs work with things like, have any of you ever met someone who maybe doesn't have use of their legs but drives? And so sometimes we're adapting a vehicle with handheld controls or a lift, or we might be putting a lift in a house. As an OT with a veteran, I got to help design an elevator and an accessible bathroom in his home. So that was really exciting to work with the architect and come up with floor plans and different tile surfaces that will be safest for him with his Parkinson's so he didn't slip and fall. But OTs can work on adapting that environment or using tools like this to help people to do those things they need to do.
I still use a great quote from you years ago. You said, PT helps people get back to where they were. OT helps you where you are right now. And I just love
Yeah, we always focus on the what's going on and how can we either get over it, under it, or through it. And so I don't know if any of you remember that book from when you were little, but that's really what OTs do, is problem solve and come up with different ways of tackling what people need to do.
All right.
Yeah.
We're going to head to the gym. So let's give her a round of applause.
Yeah. Thank you, guys.
Allison, you may send some. Thanks.
Bye. Thank you.